Hi everyone, it's Min from Microbiology, and today I will be talking about the hepatitis C virus. The hepatitis C virus is part of the Flaviviridae family of virus. Just as it is named, it's going to cause the hepatitis C disease. Hepatitis is liver inflammation, so this virus is going to inflame the liver. Its genetic data, nucleic acid, it's a single-stranded RNA. It is an enveloped virus, which means it has a capsid coating around it. There's 6 different genotypes of the virus, so there are 6 different targets for antiviral drugs. And another important note to make is that it has a very high mutation rate, so the protein membrane surrounding the virus tends to have a lot of different mutations, which makes a vaccine finding a vaccine for the virus particularly difficult, which is why as of the present day, there is currently no vaccine for the virus. So what does hepatitis C virus do? Well, it's going to affect hepatocytes, which are basically your liver cells. It's going to bind to different receptors on those cells. This includes CD81, Claudin-1, occludin, and LDL. And once it binds to the cell, it's going to enter the cell and do what viruses normally do. It's going to replicate itself using the host cell's machinations and then release itself along with a bunch of its own copies and infect other cells. So, how is hepatitis C transmitted? Well, reservoirs for hepatitis C include humans, so people that are infected with hepatitis C can give it to other people, and also their blood. So if there is an infected person's blood and that is somehow ingested into the body, that's going to potentially give the new individual hepatitis C. So main methods of transmission include needle sharing. So if you share needles with someone that has hepatitis C, you can get it. Accidental needle stick. This is something that's prevalent among healthcare workers. It's always a possibility. It can also be transmitted from a mother that has hepatitis C to her newborn child. And in rare cases, it can even be transmitted through sexual contact. So, with these transmissions in mind, high-risk individuals would include IV drug users, people that would share needles or could share needles, also people with hepatitis B or HIV, since their immune system is at risk, and also organ and blood donor transplants, not donors, transplant recipients before 1992 specifically. And there is a good reason for this that I will discuss later on in this video / slideshow. So, some clinical facts about hepatitis C. The incubation period for the virus is about 2 to 12 weeks on average. It can actually go on longer, I believe up to 160 days. Incubation period before symptoms show. Some signs and symptoms that would be present would be your basic flu-like symptoms. This includes fever, general malaise, fatigue, nausea and vomiting, arthralgia, which is pain, joint pain. You would also have very specific signs and symptoms of something that affecting the liver, which would include right upper quadrant pain in the abdomen, some dark urine, or even jaundice, which is, as you can see on the picture of the right side, yellowing of the eyes and of the skin. But symptoms are pretty uncommon. Most of the time, people are asymptomatic, up to 80% of cases. So it's not obvious if someone has hepatitis C. Once they do have symptoms, though, they tend to have it for roughly 6 months before it resolves. However, chronic symptoms are usually much more common. So chronic hepatitis C is a pretty big issue. And so people can give other people hepatitis C 1 to 2 weeks before symptoms show up. However, if someone does have chronic hepatitis C, then they are contagious indefinitely. Serious complications of hepatitis C include cirrhosis, which is scarring and liver failure, as you can see on the picture on the bottom, and hepatocellular carcinoma, which is cancer of the liver. So again, just as a reminder, this virus, hepatitis C virus, does attack the liver cells, and so this attack can cause liver tissue scarring. Hepatitis C is a pretty prevalent virus. It isn't located in one geographical site. It affects everyone worldwide. However, it does have a high prevalence towards the Eastern Mediterranean area, Eastern Europe, Southeast Asia, and the Western Pacific region, the islands. So, how can you prevent yourself from getting hepatitis C? If you are someone that works with in the healthcare setting or works with a lot of sharps, it's important to have basic sharps training. This includes making sure everyone else around you knows that you have a sharp, and also safe disposal and utilization of syringes and other sharps. And again, even since sexual contact is a rare way of getting hepatitis C, it's important to practice safe sex. To get a diagnosis of hepatitis C, you can do an ELISA, which is an assay to look at antibodies in the body to see if you have the anti-HCV antibody. If someone does have it, they can follow up by doing a PCR application of the blood to see if the hepatitis C virus RNA is present in the body, and also do a liver biopsy to look at a piece of the liver tissue and do some more diagnostics on it. Treatment for hepatitis C would include basic antivirals. Usually this treatment is given over, I believe, 12 to 24 weeks and will resolve the virus pretty quickly. Now, as I mentioned earlier, any organ or blood recipient before 1992 were at high risk for HIV. Or, sorry, not HIV, hepatitis C. So what's changed about that? Well, in around that time, these three gentlemen were the ones that discovered what hepatitis C were. So before then, people were getting sick after blood transfusions, and people suspect a hepatitis-like virus was causing an issue but could not identify it. And so these three scientists, Harvey J. Alter, Michael Houghton, and Charles M. Rice, did manage to figure out what was making people sick after blood transfusion. And so through their work, they won the Nobel Prize in Medicine in 2020. So it was after the discovery of the virus that, blood donors, their blood was screened for this virus. And so this is something that blood donation groups screen for before accepting blood ready for transfusion. So this has helped prevent a lot of people from getting sick from blood transfusion, and is hopefully a step forward in eliminating hepatitis C around the world. Thank you.